Hello, this is Jason Robertson speaking to you here from Seattle, and I am excited to talk about an upcoming short course we'll be doing with Acuterapia in Brazil about clinical reasoning in traditional East Asian medicine. I'll be speaking about this subject on August 5th and August 19 in an online course translated for the first time into Portuguese. This will be the first time some of this material from my teacher, Professor Wang Ju Yi in Beijing, who passed away a couple of years ago, will be taught and translated to Portuguese. So this is really an exciting opportunity to get to know a current of thinking, an approach to acupuncture that grew in the 20th and early 21st centuries in Beijing and is firmly rooted in classical concepts. In fact, for these two short lectures we're going to be doing with Acuterapia, what I would like to focus on is the concept of how do we translate this idea of clinical reasoning, which is of course important in medical education, whether it be traditional Chinese medicine, acupuncture, or any type of medical education. How does one generation pass along their way of approaching the clinical encounter, their way of kind of problem solving in difficult cases, and then get this into the students of the next generation and allow this material to be passed on? Now, maybe some of you are familiar, in modern medical education, clinical reasoning is also often presented in these kind of decision trees, where if there's this kind of problem and you may have this kind of medical test result, then you might then consider this disease, et cetera, in these decision trees. What I've done in my research, and this came out of my study for over 20 years with Dr. Wang Ju Yi in Beijing, is I've noticed that what has happened in traditional East Asian medicine is kind of a different way of clinical reasoning. And it really comes down to the cultivation of our own E. And this character E is one I will talk about for quite a bit in our lecture. But just as a quick preview, E, there's many different characters pronounced E, but E is the E I'm talking about is the one that is often translated as thought, associated with the mind of the spleen organ. And this E is also sometimes translated as your intention in the practice of acupuncture, or you might even say your attention when you're seeing patients. And so in my research into clinical reasoning, looking at the classical text, what I noticed is it seems like one model for developing as a practitioner is for all of us to cultivate our E, to cultivate the things we pay attention to in the clinic. And so in this lecture, what I'd like to present to you is from the perspective of one practitioner. That's, again, Professor Wang Ju Yi of Beijing. I would like to, take his approach to acupuncture, which he called Jing Luo Yi Xue, or applied channel theory, as I translate it into English, and present this as a current of thinking in acupuncture, and present to all of you, his way of seeing the clinical encounter. So not, in other words, coming up with a bunch of protocols or, clinical tricks, but instead really kind of opening the door to how the mind of an experienced practitioner practicing in the modern era, but firmly rooted in classical text, sees the patient encounter. Like, how can we use the wisdom of the centuries of Chinese medicine that has come down to us and all of the kind of perceptive tools that, we know of as looking at the tongue or feeling the pulse, or in Dr. Wang's case, palpating along the acupuncture channels. How do we use all of this to create a diagnosis that still remains firmly planted in the physiological model of the classical text? And so that's a lot to talk about, but it's really going to be another way to put what we're going to be doing is, if you've studied acupuncture from TCM style approach to acupuncture coming out of mainland China in the 20th century, this is going to be different than that. If you've studied other forms of acupuncture that are currents of thinking from different schools of thought, I think this will be different than that. And what the history of East Asian medicine has shown is an experienced practitioner has the ability to shift their way of seeing a given clinical encounter as a way of problem solving. If you are treating a difficult case and you're not getting good clinical results, then the best thing is to be able to completely change the way you're perceiving that patient, to have a different way of viewing the patient. So what we'll be presenting in these two lectures in Portuguese will be cultivating a different way of seeing. So cultivating a way of thinking in the clinic that allows for creativity and flexibility in the presence of the kind of chaotic and difficult cases that are showing up in the modern era. So you'll see more information about this course on the website here. And I hope you'll join us for this first ever opportunity to present applied channel theory, Jing Luo Yi Xue, in Portuguese. So look forward to seeing you soon. Thank you very much. Bye.